Many organizations want to use evidence-based practices that improve client outcomes and generate savings. Too often, they'll send their providers off to get trained on a particular practice and assume that will be enough. But when those providers get back from training, they struggle to adopt the practices without the needed support and resources. LOCI, which stands for Leadership and Organizational Change for Implementation, is a multifaceted leadership development package that guides organizations like hospitals and mental health clinics to use evidence-based practices as part of their daily workflow. LOCI doesn't just focus on convincing a single leader about the importance of evidence-based practices. Instead, LOCI works with your entire organization to identify and remove barriers to delivering evidence-based practices. LOCI also works directly with leaders to identify creative and meaningful ways to support frontline workers in using evidence-based practices to address client needs. LOCI goes beyond simple, out-of-the-box, one-time workshops by providing tailored solutions to address the unique needs of your organizational leaders. Throughout the LOCI process, our team will work with your organization to collect data that is used to educate leaders about how their teams view their leadership efforts and their support for evidence-based practice. LOCI facilitators then work with your organization's leaders to create action-oriented plans to effectively move their teams and organization forward in the implementation process. Coaching sessions and organizational strategy meetings allow leaders to reflect on their progress toward their goals and brainstorm ways to further align their efforts to establish a culture that promotes evidence-based practices. There is no silver bullet for implementation, but by bringing leaders across levels together to align attitudes and efforts related to evidence-based practices, we can maximize the likelihood for achieving effective implementation and ultimately improve the health and well-being of patients and clients.